Hello, my name is Matilda and I'm an adult nurse volunteering with the first aid support team, FAST. FAST is a registered charity bringing together healthcare professionals to care for people camping in Calais, Brussels and Dunkirk. On a typical day with FAST, we would meet in the morning at the storage unit and spend some time sorting through donations, our equipment and restocking our supplies, making sure that we are fully prepared for the day ahead. It's also really important to ensure that all of the supplies in the storage unit are kept at a reasonable standard so that they're all in date and accessible. Then in the afternoon we would head out to treat people for a few hours, generally heading to a couple of different sites during the course of the afternoon. FAST works in partnership with other associations that are active in the area, so we would often set up our first aid stall alongside a distribution, say of food or clothing, which helps us to access people. There is now a regular schedule so that people know where they can find us, which is really important. In terms of the conditions that we see, people here have often travelled a long way, so there is a lot of ankle and knee pain, whether from wear and tear or from an actual injury. It's a very active and mobile lifestyle, so there's a lot of opportunity for minor falls, sprains, cuts and grazes. There is also a high prevalence of foot problems, such as athlete's foot or blisters. People on the whole are tolerating a range of minor complaints that we would think very little of going to a pharmacy and just getting sorted out if it was ourselves living in the environment that we're used to be living in. Living in tightly packed camps, the situation really promotes the spread of infectious diseases. So everything from a typical cold or to chest infections, some of which have gone on for several months. Where necessary, FAST can signpost people to hospitals and clinics that will treat them in a more in-depth manner, because what FAST does is always just first aid. Working in critical care, I typically treat 1 to 2 patients per day. Here at a busy site such as in Brussels, we can see perhaps 50 people in the space of a couple of hours, so it's a complete change of pace. And having a good team really means that we can give people the treatment that they require. People think of Calais as the jungle, and now that the jungle has been cleared, it's perhaps slightly harder to understand what is going on here. What we have in Calais at the moment is a mass of fences that keep getting higher and higher. We have people being frequently evicted and pushed into smaller campsites. Effectively, there are still jungles, but they are more cramped, or they are pushed into different locations and made to move around a lot more. What FAST tries to do is we try to get to a lot of these different locations as often as we can. Definitely the majority of people that we treat are young men, although I was surprised to meet quite a lot of older people, some of whom are also dealing with chronic health conditions such as arthritis. I think sometimes a lot of reporting can focus on the idea of women and children suffering in this situation. But to me, I want to be absolutely clear. This life is not good, it is not adequate, it is not acceptable for anybody, no matter their age, gender, nationality or refugee status. It is a question of people's basic rights, of your dignity as a human being. It's really as fundamental as that. So when we have this situation where people's essential needs are not being met, the obvious question that I kind of hope you're asking yourself is, what can I do about this? And if you are somebody with a healthcare background, whether that be nurse, doctor, paramedic, physiotherapist, or medical student from the 3rd year up, the answer really is to come and volunteer with FAST. Both times I've been here, I have had a truly amazing experience. I've just found it so stimulating. It has really reminded me of some of my core reasons for going into nursing. There is now a full-time volunteer field coordinator, Jonathan, who will be here to welcome you when you arrive. If you are watching this and you don't have a healthcare background, then there are several other associations who are active in the area who you could potentially give your time to. I will try to link them down below. But please, if you are able to, do consider making a financial donation to FAST, which you can do via the website f-a-s-t.eu. As such a small project, really everything that you give goes directly towards purchasing the most needed supplies and running the FAST car to get to all of these different sites. You can also, of course, share this video, tell people about what FAST do, particularly if they do have a healthcare background and could be interested in volunteering. And you can do what you can to promote a society that is open and welcoming to those in need. By providing first aid, all we can really do is treat the symptoms. We need a bigger change socially to stop this from happening. a change that building more fences is not going to bring about. So thank you very much for watching, and please don't hesitate to get in touch with any questions that you might have.